Good morning, my name is Dr. Paul Craven. I'm the Medical Controller for the COVID-19 response for Hunter New England Local Health District. Today we're going to walk you through the screening station and also the testing centre that's opened at the John Hunt Hospital. When you walk in the front door of the John Hunt Hospital, all patients that are going to the emergency department will first be stopped at the screening station. The idea of stopping all patients going to emergency at the screening station is to see and to tell what their risk factors for COVID-19 disease are. Morning, Kathy.
Good morning.
You're one of the people that are manning the screening station here at the John Hunt Hospital before going to emergency.
Yes.
Can you tell me, please, what you would normally ask all patients coming through the door?
Sure. So if someone's going into our emergency department, we would ask them have they had any overseas travel in the last 2 weeks, or have they had a contact with a confirmed case of coronavirus.
Beautiful. And I take it that people who have travelled or had known contact with coronavirus at that stage, what you're wanting is people with symptoms to test at this stage. So what sort of symptoms are we looking for?
Okay, so we'll be looking at people who have a fever, a cough, runny nose, sore throat, people who are unwell.
Yeah, and shortness of breath is an important sign as well, isn't it?
Sure.
Beautiful. Yeah. So what do you do here? Can you tell us what you do here?
Okay, so everyone that comes in that needs to be screened, we would ask them to wash their hands with the gel.
Okay, I'll do that just to show. There we are. So I'm going to gel my hands now.
We'd ask you to put a mask on.
Make sure I get it all over my hands.
Yes.
Okay.
So have a mask on.
Okay. Now I have no risk factors, so I won't put this on, but obviously when people arrive here, this is what they have to put on.
If anyone had symptoms and we were sending them for screening, we would ask them to put a mask on.
And a bit like you've got on now, I would wear one.
Around here. Yep.
Beautiful, thank you.
Okay, so then we just would take your temperature, your oxygen levels to see how you're breathing, and your heart rate.
And that's like an assessment to see if I'm well or not.
Yes.
Okay, and how do you do the temperature?
Okay, so we just take a temperature. You're normal.
Beautiful, fantastic. So I've got a normal temperature, so that's a good thing. Okay. And then what do we do next?
And then we will just take your oxygen levels on your finger.
Beautiful, thank you.
So just measure your heart rate and your oxygen levels just to see how...
And we do this because obviously COVID-19 often affects the chest of people.
Yeah, sure.
Beautiful.
Have trouble breathing, so this is
lovely.
So you're going very well now.
I'm going well this morning? Fantastic, that's great. Thank you very much, Kathy.
Okay, no problem.
So at the moment, obviously I have no risk factors, but I am going to go through the testing centre at the moment to have a look. So thank you very much for screening me this morning.
No worries, thank you.
We're going to walk into the testing centre now. And in the testing centre, and it's just before it's open now, the first person you meet is Ruth. Good morning, Ruth. I'm good, thank you. How are you going? The testing centre has been set up to keep both visitors, patients, and also our staff safe at all times. At the testing centre, you're going to be asked a number of questions. Those will be your name and date of birth, where you live, what your current address is, your mobile phone number so we can contact you later, an email address, emergency contact number, your Medicare card number, and also who your current GP is. Once you have provided those details to Ruth, Ruth will ask you to sit down on one of the chairs, and then you'll be in a queue to go through to the testing centre. So let us walk through to the testing centre. We have a number of staff here. We have 2 nursing staff, and we also have one of our cleaning staff. And Amy, you're going to greet the visitors to the hospital when they arrive into this testing centre. What do you do, Amy?
Yeah, absolutely. So what I'm going to do is ask for your details, just to confirm your details, make sure you're the right person. I'm going to ask you for your observations that were attended at the screening station to document them in your medical record so that I know that you are safe to be discharged from our screening station.
So those observations will be written down. I will show them to you at that stage, but I'll keep them.
Yes, correct.
And at that time, obviously, you'll know that I'm well enough to go back home again.
Yes.
Fantastic, thank you. And obviously, I've got all my details documented so that we can track all the results.
Yes, correct.
Brilliant, thanks, Amy. I really appreciate that. In here also we have Brenda as well. Brenda is one of our cleaning staff who is in here all day. So thank you, Brenda, for being here. And I think what's really important is for people to realise is as we are swabbing patients, Brenda is actually cleaning behind those patients, cleaning the rooms, cleaning the seats people are sitting on as well. So it's about keeping visitors and staff once again safe. Thank you, Brenda. And then we have Jeremy here. Hello, Paul. Good morning. Jeremy, what are you doing and why are you dressed the way you are?
So I'm dressed this way because I'm the nurse responsible for testing you for the coronavirus. So what I'm going to do for you today is give you 2 swabs. One of your nose, feels a bit tickly, makes you feel like you want to sneeze, and one of the back of your throat.
Great, okay. So once I get to this stage, I have no risk factors, but for people who do, they're going to come in here and have a set of swabs. Why are you dressed like that then?
So the reason we dress this way is this is the best infection prevention guidance that we have. In between all patients, we dress in this dramatic way to protect not only ourselves but to protect all of the patients that we're swabbing. So this just helps contain any potential germs while we're doing the swabs.
Fantastic, that's excellent. Now I think it's important we show people what the swabs are as well. We'll show them one at least anyway, and I think I'm going to get my nose swabbed. Is that
my
right?
pleasure.
Lovely, okay, so let's
Step
go.
right this way.
Thanks.
If you have a sit on the seat here for me, Paul.
Thank you. I think the room is very empty at the moment. We're trying to keep it empty so that we have fewer surfaces for any germs.
Definitely. So what will happen is, like we said, we'll do a swab of your nose and swab of your throat. For demonstration purposes, we'll just do a swab of your nose. So the swab we have is a skinny little swab. I'll get you to look straight ahead. I'm just going to put this swab in your nose, twirl it around to take it out.
Thank you.
Not too bad.
A little tickly as you say, but very easy to do.
And that's the whole process.
And that's it.
That's it.
Fantastic. Thank you, Jeremy, for showing us how to do that today.
My pleasure.
Where does that go now?
So now what we'll do is we contain this. Amy out here has a pathology bag, so we'll put the test with your identification in a bag, and it'll go to our lab periodically through the day.
Fantastic. And then that lab sends us for testing, and we get those results back in the next couple of days.
Indeed.
Jeremy, thank you very much. I really appreciate you showing us
Pleasure.
and also swabbing my nose. Thank you.
pleasure.
Once our tests go to the laboratory, we wait for results to come back. Results will then be phoned back to patients once they gain back into the system. So we're showing you through both the screening station, where you are assessed for your risk factors, and I will remind you again, it is travellers who are sick with a fever or signs of respiratory, such as a cough, such as a sore throat, and such as shortness of breath. And then there's one of 3 pathways, either into emergency if you're sick, home if you don't have risk factors, or also into the testing centre. The other patients we are also wanting to test at that stage are contacts who have had visitors who have had known contact with someone with COVID-19 disease. So thank you everyone for doing what you're doing, and we'll see you soon.